This is our vital signs practicum return demonstration. First, she is going to accurately measure the temperature using either the oral or temporal thermometer, cleans and prepares the thermometer correctly, places in the correct location, and correctly takes the temperature. She will discard the protective covering and/or clean the probe if necessary, and record the temperature accurately, including scale and type. Temperature was 97.6 degrees Fahrenheit oral. Next, we're going to assess the radial pulse at the correct location using our 2 pointer fingers and not our thumb, and getting the correct count and using the correct technique to do that. She will verbalize the rate she gets when she is completed doing the radial pulse assessment. And while she's assessing the radial pulse, 62 beats per minute, and while she's assessing radial pulse, she can also assess the respiratory rate unobtrusively and get the correct count. She will also be assessing for rate, rhythm, and effort of the breathing pattern.
Respirations, 19, unlabored.
And then the second pulse she'll get is the apical pulse for this patient. She's going to get the correct location, which is the 5th intercostal space, left mid-clavicular line. She is going to put the stethoscope to skin and listen for 1 minute at this location, getting the correct count there. She will verbalize the location that she is assessing for the apical pulse.
60, assessing at the 5th intercostal space, left mid-clavicular.
Next, we're going to get the patient's blood pressure. And first, we're going to ensure the appropriate cuff size for this patient, just by looking at the patient's arm and measuring the length of the cuff that is needed. The cuff is placed on the skin at 1 inch above the site of pulsation. So we're assessing the brachial pulse here. So she's going to place it 1 inch above the brachial pulse. We're going to correctly estimate the systolic first, and then pump up our blood pressure cuff to 30 millimeters of mercury higher than the estimated systolic. So to estimate the systolic, she's going to palpate the brachial pulse, and whenever the pulse goes away, that will be her estimated systolic level.
I lost it at 120. So I'm going to pump to 150.
Going to release at the appropriate speed, which will be 2 to 3 millimeters per mercury a second. And the first quarter cough sound she hears will be the systolic. The last one she hears will be the diastolic reading.
Okay. 120 over 60.
And then the last thing she will do is check the patient's SpO2 or pulse ox. And as always, she's going to verify that the patient has an order for this procedure to be performed, provide the patient with client comfort and privacy, following all principles of standard precautions, using proper body mechanics, and completing the procedure in a reasonable time.
Perfect. SpO2 side 99. You're good to go.